Democratic Visions is handmade in Eden Prairie and Minnetonka by DFL Senate District 42.
Welcome to Democratic Visions. Our guest this evening is Commissioner Jan Calison. She represents District 6 on the Hennepin County Board, 14 separate municipalities. All are part of those, including Edina, Eden Prairie, and Minnetonka. So now you are right in the middle of the budgeting process, are you not?
That is correct.
And this is the 2010 budget.
That's also correct.
Before we talk about the 2010 budget, tell me a little bit about what went on in 2009. Did you finish in the black?
Well, the books aren't closed on 2009 yet, and we lost some funding. The governor unallotted about $14 million. So the county has taken some measures to put us in the black, if you will. So I think at the end of the year we'll be in good shape, having made some cuts.
So what steps have you been taking to attempt to right the ship for 2009?
Well, this is the second year. In 2008, there was an allotment as well, about $10 million. So it's the second year of a series of steps. The county staff has been frozen, so there's about 200...
Hiring freeze,
or 200 positions that have not been filled. We asked employees to take 3 days of special leave without pay. That means they volunteered not to be paid for 3 days and not to work. We cut money from the capital budget for 2010 and out years, made changes in travel, changes in equipment, a variety of things to bring the budget back under control.
How many employees does Hennepin County have?
About 7,200.
Did a goodly number of those accept this idea of taking unpaid leave?
Actually, it was very well accepted, and initially we thought we might have to do it on a mandatory basis as opposed to a voluntary basis. It really was the employees who asked to be given the opportunity to do it on a voluntary basis so that those who could afford to take days off could, those who couldn't afford to do it would not have to, and it's worked out very well.
What's your prediction as to the 2010 budget?
The county administrator, Richard Johnson, presented his budget to us last week. In 2009, the county budget was $1.7 billion, billion with a B. The proposal for 2010 is $1.6 billion, so about a 6% decline.
Really?
And that, as I say, continues a pattern of the county tightening its belt. My expectation is that as we go further into 2010 and 2011, which actually looks worse than 2010, we're going to begin to see that the effects of the county tightening its belt will not be limited to the county, and we'll begin to cut programs and make changes in services that we provide.
Well, the Hennepin County Board is the governing jurisdiction over, what, 1.2 million people?
Correct, roughly.
Do you find that people have a misunderstanding or lack of understanding what the Hennepin County government actually does for them?
I think that's very common.
Tell us, briefly, if you would please, what roles does the Hennepin County government fulfill for the people of Minneapolis and the environment?
Well, it has a public safety function, as most units of government do. So there's a county sheriff, operates a jail system, the adult correctional facility, the detention facilities, that's all under the county's jurisdiction, has a road program. County roads are maintained by the county, plowed by the county, built by the county, involved in the light rail system, operates the public libraries. But more than that, and what I emphasize when I talk to people, is that the county is the social service arm for the state of Minnesota. So the state of Minnesota mandates that certain social services should be provided. It generally doesn't provide those directly. Instead, county staff provides them. So the example I usually give is the state sets out standards for treatment of children. Shouldn't be abused, need to go to school, certain expectations of treatment. If that doesn't happen, it's not a state worker who comes to somebody's house. It's a county employee who comes, might remove the child, assesses the family, puts in place the standards or the criteria that have to be met for the child to go back to that home. That's all done by the county for the state of Minnesota, and in expectation of being paid by the state of Minnesota for the services that the county provides. Commissioner,
where does the county get its money to fulfill those undertakings?
About 40% comes from property taxes. That may be less than people think. The rest is coming either from payments from the federal government, payments from the state government. There's a deed tax. There are permits that the county and fees the county collects, interest on income, a variety of sources. But more than half the county budget is not from property taxes.
Can we focus in on the Hennepin County Medical
Sure.
Center? That is in dire shape financially, is it not?
It is in critical condition. I think that's fair to say. I think the facility of the staff at Hennepin County Medical Center would say it's critical.
And is it true that the various unallotments and lack of funding have are the main contributor to what the HCMC currently finds itself in?
Well, unallotment really deals with Hennepin County itself.
Yes.
So there's something called county program aid that was unallotted. That doesn't go to the medical center. The medical center legally is a separate jurisdiction from the county, but the county is still tied to it financially because the county pays for the uncompensated care that comes through the Hennepin County Medical Center as well as guaranteeing its liquidity. What's happened is that the state has changed the insurance program, eliminated general assistance medical coverage as of, I think, March or April of 2010.
Well, actually, excuse me,
Yes.
the state didn't eliminate it. Didn't Governor Pawlenty, with his veto, eliminate the funding for GMAC?
Well, there are a number of decisions made by the state of Minnesota. The legislature made some, the governor made some. So there's a whole picture of restrictions and fewer resources. But the one that really is going to affect Hennepin County Medical Center is the GAMC. And what that means is a couple of things.
Before we
Sure.
do that, GMAC, that's the safety net for poor working adults or adults that simply don't have the means to
Okay.
procure health insurance?
I've heard it described as health insurance for the poorest of the poor. So it picks up people who really don't have any other options. It doesn't mean that everybody has health insurance in Minnesota, because not everybody does, but general assistance medical care provided resources to people who couldn't get insurance otherwise. So that program is going to be eliminated. There's some expectation that maybe some of those people will be covered through Minnesota Care. I don't think there's an expectation that that really is going to happen in large numbers, but it could. More likely, people will not have insurance. They still will need medical assistance. They will come to some place like Hennepin County Medical Center, which is a safety net hospital. And when they do, and when they have no insurer, and when there's no one to pay for their care, the bill will be sent to Hennepin County, which means the bill will be sent to the property taxpayers of Hennepin County. And the number is about, the expectation, and this is a guess, is about $43 million lost to Hennepin County Medical Center. That 3% amount that we're talking about for next year is about $20 million. So there's still a considerable gap that's likely to be facing the medical center and that they're going to have to deal with. And this is...
Deal with and how? Lay off people?
well, they've already
Close
done that.
facilities?
They've already done that. This
Are they
isn't
gonna
the first year.
Are they going to close the hyperbaric chamber, do you know?
I don't know that they're going to close it. That's been on our list of what we have asked for funding for. We asked for stimulus funding for it, or had it on our initial list. There's no money available for it yet. I think it's a program that they will look at closing. But it's the sort
Somebody
of resource.
suffering from carbon monoxide poisoning?
You know, it's a statewide resource. Should it be funded by the state or by the
see.
residents of Hennepin County?
Okay. I'd like to turn briefly to the new light rail transit that's being promoted. It can hardly be disputed that the Hennepin County, the Hiawatha line has been a resounding success. So do you have the same expectation for the southwest corridor?
The numbers in terms of ridership are very good for that southwest line. We have to meet some expectations by the federal government in terms of what the cost is and the benefit, and we'll have to work on that over the next submission or the submission of the federal government, but this line looks very promising. The route that is recommended so far by the Technical Advisory Committee is the route that actually does not go on the Hennepin County right-of-way. It comes down through Opus, through the Golden Triangle in Eden Prairie,
Okay.
And comes down into the Southwest Transit station. And the process right now is there's also a policy advisory committee made up of local officials, local representatives. They'll be making a recommendation in October. There'll be a public hearing before the Hennepin County Regional Rail Authority. There'll be a decision made by the Rail Authority in November, and that decision will be to identify the locally preferred alternative. At that point, or after that point, it's hoped that we'll be able to hand the project to the Met Council, who will prepare it for submission to the federal government for funding.
And what do you get, 50% from the federal government?
Yes.
Where's the balance of the money going to come from?
Some would come from the county's Transit Improvement Board. Some would come from the state of Minnesota, various percentages.
What's the price tag on that?
About $1 billion.
Are you a proponent of that?
Yes, I am. The advantages, I think, are a couple. Improved transportation options. I think that's important for all of us. I think in this area it's going to link us to jobs. It's going to enable people to come out to jobs that are in Minnetonka and Eden Prairie. It's going to enable us to fulfill some of our goals around housing. So in Minnetonka, in the Opus area, which is an area where there'd be a stop, that's an area where we expect more density to come in. So this metro region was supposed to have another 1 million people by 2030. Part of the objective is to house them in some denser areas of the community so we don't continue to sprawl, so it helps us achieve that objective as well, and some of the linkages that are important for our communities.